So today's video is another brilliant masterpiece in educational content from Prager University. This video is called Medicare for All Will Destroy Healthcare, and I'm here to tell you why it won't. But before that, I just wanted to announce that this particular video was recommended to me from someone on Twitter who messaged me and asked me to debunk it. And I just want to remind everybody, I'm willing to take suggestions for videos that you want to see debunked either from Prager University or from anybody else. If you feel like you want a video dealt with, give me a little bit of time to, get up to it and do it. But also leave a comment down below with the title of it or send me a message on Twitter. I'll respond to either one as best I can. With that said, let's check out this video.
What's up, guys? This is Will with Prager U, and let's go over why Medicare for All won't work. First of all, it destroys innovation within the free market.
So this one is one of the arguments that I was prepared for. Typically, that's one of the first things they run to, right? Oh, innovation's gonna die. Unfortunately, that's not true. The NIH, the National Institute for Health in the United States, is one of the biggest funders of innovation spending in the United States, and some would argue has a greater vested interest in spending for actual research than a lot of private institutions. Private institutions like insurance companies don't typically have the incentive to produce research that is specified for the needs of the people in their organization, because what they end up doing is trying to find shortcuts to maximize quarterly earnings in the stock market and in their industries. So the NIH ends up spending this money in research with the broader understanding and wanting to bring a scientific consensus. They're actually one of the biggest spenders in the world, and they're a major contributor to all of this. And as long as we keep funding the NIH, which is their funding is in like the billions of dollars, like 40-something billion dollars. And we could probably manage to easily supplement some of that spending for that private insurance companies wouldn't be throwing in through that NIH system, and it would probably create more efficiency and less redundancy in terms of research. And before I do that, I do want to just show you some numbers that I had prepared if I can find it. Here we go. We have the NIH website, their impact, and it says with a 2018 budget of over $37 billion, it's the largest single public funder of biomedical research in the world. Every state and almost every congressional district has earned a share on this investment. The NIH Extra Mutual Fund generated an estimated $68.8 billion in economic output nationwide. NIH funded 50,885 grants that directly supported 313,049 full and part-time positions, and discoveries arising from the NIH research provided a foundation for the U.S. biomedical industry, which contributed $69 billion to our GDP. So not only is this organization funding and innovating research, it's bringing money to the U.S. economy. All of that money will provide certain incentives to driving down some, but probably not a good portion of what a single-payer system like Medicare for All would cost. And you could go through this whole thing about how it drives economic growth. Its healthier citizens lead to a healthier economy. They have a lot of statistics that back up their financial position. For example, the HIV vaccine, developed through NIH research to immunize young children against a bacteria that causes the most common form of childhood bacterial meningitis, is estimated to save society more than $1.8 billion in direct treatments costs for children born in 2009 alone. So when you start looking at all these numbers, and again, feel free to check out their website, feel free to explore these numbers. They are a valuable piece of information to show exactly how it is that the U.S. government's own research facility their own facility that funds research which is paid with federal dollars, works very well at providing innovation within the society. And there's no reason to think that this would be shut down, but rather expanded under a Medicare for All system. And getting back to the video.
If the government is the only provider of medical insurance, that means that the government are the ones setting the prices.
I want to hear that one more time. He speaks really fast, and I kind of get the impression that this is going to be one of those videos where he just speaks as fast as he possibly can to try to, like, make sure that you miss the little details of what he's actually saying. So just bear with me.
Is the only provider of medical insurance, that means that the government are the ones setting the prices.
Okay, there's a truth to that. What he's saying is actually true there. Because in our current system, you have to understand how prices work in healthcare. If I'm understanding where he's coming from correctly, what ends up happening is that you have financial costs that are applied to a bill for any person who visits a hospital or goes to the doctor. And let's take the example of a hospital. When you get a bill at a hospital, some of those bills can just be outrageously priced. You had a surgery to save your life and you come out with a $90,000 bill. And they don't have anything to correlate that to $90,000 worth of value. The problem with the medical industry compared to a lot of other industries is that when you're lying on an operating table, you don't get to negotiate price. You don't get to say, hey, actually, I don't think that this surgery is worth $90,000. Why should I pay it? And that's because if you don't pay or don't agree to it or just don't accept the care, you are going to lose your life. Right? So there's a certain level of monopoly of expertise that doctors and nurses tend to have. There's a certain level of the critical nature of certain types of care where they are not able to deny you that. Like there's a certain monopolistic tendency, although I hesitate to use that word. But there's a certain level of control that they have over life. And when you're asking to put a price on one's life, the value can range from any number to limitless. So them throwing you that $90,000 doesn't really have a basis in a market system, in my opinion. Like it's founded completely on a situation where it's either your money or your life. And not in like an extortion way, but just you don't have a choice if you want to stay alive. And when insurance companies confront this $90,000 bill, they're able to call up the hospital and be like, hey, so I hear you're charging $90,000, but we're going to come up with an agreement with you, and you're only going to charge our client $3,000, which we're going to pay $2,500 of, and the client pays $500. And the hospital says, yep, that sounds great. And if you're somebody who's poor or unable to financially afford that $90,000, you might get it lowered if you talk about it and everything else. But those medical bills, they don't go away. They don't affect your credit score, but they don't go away. And a single person having to pay that money is paying a much more exorbitant rate than an insurance company. So already right now, private insurance companies are setting the rates for doctors. The government, through Medicaid and Medicare, does a similar thing. And if we went to, for example, this Medicare for All system, the government would unilaterally be doing it, which would probably force prices from doctors down because they would have no competition. So there would be a desire to find a fair market price for what certain procedures cost, and it would probably be relatively the same across the board, with exceptions of maybe fully innovative research, which again would allow for fully innovative research to exist, because then that doctor would be one of the only people able to perform that procedure and would have a lot more leverage. So basically the government would be the insurance company on our behalf driving those prices down, as opposed to having a huge competitive market where doctors can say, well, I don't want that insurance. they don't give me enough money. So that's what he's talking about with driving the price down. I don't see that as a bad thing, by the way. I quite frankly see it as a good thing. I know a lot of doctors will be upset because they're estimating probably as much as 40% decrease in funding for individual institutions and possibly for doctors. But I think that's an acceptable loss considering one, there will be many more people able to go to the doctor, and two, there will be a situation where with the advent of certain innovations like telemedicine, you might even be able to create more time in which a doctor can see patients. So they might be able to make us up some of that cost in the future through developing those technologies.
That means that the only price that you're going to get is from the government. Have you
Who's you? The only price you're going to get is from the government. In Medicare for All, you're not paying anything. If you follow Bernie Sanders' plan, people in the United States will only have to pay up to $200. So I don't know who he's talking to here, because it's not the average American citizen.
ever been to the DMV? You know how these people work? They don't care about you. They're bureaucrats who work for the government. You think that they're going to care much about the prices of your health insurance or care much about the quality? When you
Have you ever been to the DMV? Have you ever been to the, like, what was that? So first of all, the DMV is not a federal institution. The DMV is, if you have a DMV in your state, because not every state has one, the DMV is run at a state level. So yeah. And while nobody enjoys probably the process of going to a Department of Motor Vehicles, I think we can all agree that having some sort of system in which we can get our licenses and make sure that the people on the roads are driving are relatively competent would probably be better than the alternative of not having any sort of enforcement for anybody driving on the road. I think that's generally a good idea, that there's a requirement for basic training for that kind of thing. So maybe he's advocating against that. As for the bureaucracy factor, it would actually reduce the amount of bureaucracy that individual people would probably have to deal with, because instead of having to call a private health insurance to kind of maneuver around a lot of the double speech that tends to happen or the runarounds that happen from insurance companies, you'd be able to just deal directly with the doctor, dealing with this one system that would then be able to tell you, are you able to get the thing you want? Yes, no, maybe. Like, it's not going to be as bureaucratic as I think a lot of the current systems are, especially when they have very little incentive to want to pay out cost. So you have to have the runaround. So it's going to be easier on individual people. I can't speak to whether or not it would be easier for doctors to deal with the insurance, but I know for a fact my doctors have had issues with insurance before where they have had to call up my insurance company and literally fight with them on the phone for a number of things. So hopefully that kind of thing would actually be squashed in Medicare for All. That's the plan. Will it actually happen? I don't know. I don't know. You know, it depends on how things are worded in the bill and all the stuff is passed and all that stuff. But again, moving forward with this video.
you have healthcare that is run by the government, a bunch of bureaucrats, they are not going to spend your money wisely because they're not spending their own money. They're spending your money. So they don't care so much about how it's used. With all these different benefits that the government made you have in your Obamacare plan.
Okay, whose money is your money? Are we talking about it from the institution of a federal government being a representative of the people spending their money? Actually, they will have an incentive to spend it well and wisely because there's going to be probably some sort of independent research that needs to be done to prioritize spending costs, like is what is done in the NIH for research funding. I imagine something like that could exist. I also imagine anyone speaking to that type of concern would actually have to deal with the fact that private insurance companies don't want to spend money, period, the end, and often can make care worse. So having some sort of guideline as to what kind of care is needed kind of across the board and listening to medical professionals would create better care for individual people. So I'm not sure whose money he's worried about being spent. But what I really feel like he's getting at is that wealthy people who might be taxed a little more or possibly a substantial bit more, would be more upset with this system. But also, let's remember that the average person who has to pay either to their employer or through an employer plan for their insurance will no longer have to pay that money. And if a portion of that goes into taxes, then it's not really that much of a difference. So, again, whose money? He doesn't want to, I don't think he's going to say it.
It made costs skyrocket. You saw in Arizona that prices for health insurance actually doubled in a 1-year period.
Okay. So the errors, what am I looking at? Oh, so the Arizona thing, I actually brought up an article for that already because that particular one is kind of a frustrating statistic. I think it was, I believe, Mitt Romney. Was it Romney? It was John McCain. Sorry. John McCain. Here we are. John McCain running for re-election against the headwind of Donald J. Trump. Oh, God. Remember those times? Anyway, took the bad news as a gift, highlighting it, in fact, when you open up your health insurance bill and find your premiums are doubling. This was hyperbole. The amount that it really went up was like 116% on average, they claimed, but the majority of people didn't have to pay that increase. So yes, some people actually did have to had to pay double rather. They did have to pay that 116%. I'm not trying to say that that's completely wrong, but there's a lot wrong with the Affordable Care Act. We know there's a lot wrong with the Affordable Care Act. Medicare for All is a potential solution to that, so I don't know how that's relevant in this particular case. Part of the reason, and I'm not going to go into that in this video because it would take me on a tangent that would have me streaming into the abyss, but the Affordable Care Act was completely messed up by the Republican Party for a lot of reasons. And so I don't fully understand, or nor can I explain the doubling of that particular amount. But there is this article, Increase in Healthcare Act Premiums May Affect Arizona Vote. You can take a look at it. The rate increase was predicted for months. And it was only for a certain income bracket, from what I'm understanding, that basically made it such that one particular group had to pay, like I said, double, but it didn't affect the average person from Arizona. So I don't know how much that actually influenced people, but yeah, healthcare can go wrong, and it usually goes wrong when the Republicans mess with certain components of things. And yeah, things like this can happen and go wrong. We can also fix these things. I would argue that even if something like this happened, we could fix it and make it even better and try to work it out so that it's an equitable share across the board of what's being paid. So let's get back to the video. Oh, I forgot he was wearing that.
But what about my country of Sweden with my free healthcare?
Wow. Okay. What about it?
It doesn't work, okay? The only reason why these countries are able to do that...
It doesn't work. I mean, there's only a ton of evidence to show that it does work, and it's actually a really successful system.
It's off the backbone of America. America far outpaces any country on amount of medical innovation spending. So with the medical innovation that comes in the free market of America, these other countries are then able to reap the benefits with their free healthcare system.
There's a logic to what he's saying here. A lot of the money being put into this kind of research is coming from the United States. But as I've shown, the NIH, a federally funded program, is one of the greatest programs for that. They do happen to fund a good deal of the world's medical research. The US, therefore, is assisting the nations that follow, I guess, what would be called the Nordic model in that regard. The world, really, right? Like the US is a leader in innovation for that kind of medical research in the world. That's kind of a good thing, right? Like it puts us in a position of prestige as a nation. And furthermore, those models do work. Again, going into why they work would be beyond the scope of this particular video, but they do work, and feel free to take a cursory look. You could probably wiki it and find the basics of how they work and just do a little bit of the research yourself. If that's a topic people would want me to talk about more, that's fine. But as for now, I need to kind of press forward with this.
If America were to adopt a Medicare for all system where we were no longer having medical innovation, the free market,
which we will have medical innovation. It just won't be in the free market, and there's no evidence to show that the free market is the catalyst for medical research.
would see all these other countries' healthcare systems collapse because they're no longer getting the innovation that America produces. And
That's
let's
just
say
wrong.
Medicare for all actually worked in America and everyone got a good plan and waiting rooms weren't so long like they are in the UK, like they are in Canada with their Medicare for all programs.
Oof. Okay, first of all, I have never heard a sincere argument for the lines in Canada and the United Kingdom being long. Maybe I am missing something. But from what when I've spoken to people from either Canada or the United Kingdom, their wait times to see a doctor is actually lower than mine on private insurance. And I know that's an anecdote. I accept that. But to me, that's an influencing factor, right? Also, what I will say is that when you look at an average wait time, say in the United States, does that wait time factor people who can never actually reach medical care? And I ask that for an important reason. What is the average wait time of a person who, because of a pre-existing condition in a Affordable Care Act world, or such as COVID, I want to put that out there. COVID is a pre-existing condition. Pregnancy can be a pre-existing condition. When you have those type of situations and you're denied insurance and therefore can't afford to pay your bills because of that, and healthcare is not available and accessible to you either because you have no time with a large amount of work hours, or any other number of reasons that you can't actually make it into a hospital or a doctor's office because of financial reasons, your wait time, I would argue, is infinite. If we even took that number and estimated it to a number of days, months, or years that was reasonable to redefine infinite, which I don't think you really could, you'd find that wait times in the country actually decrease under a system like this. Because again, more people can actually make the wait lists. More people can actually access that medical care. And so you're not having a system where it's just a certain section of the population that gets to have a little bit more wait time. And me personally, I'll speak on this. I would rather wait an extra day to see the doctor for a non-emergency reason, or an extra day or two for a non-emergency reason, than have to deal with a situation where I know that other people in my society are not having health care. It makes no sense to me. If I'm not dying, if I'm not in an immediate need or desire to see a doctor, I don't see the problem. And again, with the advent of telemedicine, I think you're going to see that become a lot less of an issue even than it is now, because people won't be waiting in a hospital lobby for a lot of different things. Some things they might be able to deal with at home. You'll be able to just put in a claim, wait on your list, lie in your own bed, lie on your couch, never have to leave the house. And I'm not advocating that'll be something like for a broken bone or a heart attack or anything like that. But for more minor things, you can even maybe ask a nurse or a doctor via the telemedicine and be like, is this something I need to go in for? Might be a better system. Technology might help with that. And by the way, In addition to everything else I've said about technology, one thing I forgot to mention, and I'll throw it in now, is that the private insurance companies have had no vested interest in innovation for, say, electronic records. It was actually the US government that put a lot of the money in to funding electronic records, which allows for much more data and information to flow through the medical industry, which has actually been a huge factor in helping create statistical analysis across the board for what to prioritize funding towards.
Still have just huge prices for this Medicare for All system. All these leftists and socialists say that you can just raise taxes on the rich, on the 1% on Wall Street.
You
What's
could.
going to happen when these rich people don't want to pay taxes for other people anymore? They're going to leave. And then who's going to foot the bill?
Rich people are not going to leave this country. There's too much here. There's too much invested in dividends. There's too much invested in stocks. They make too much money doing nothing. They're not going to leave. Maybe you'll get one eccentric person or whatever that'll leave. I don't know. But people are not going to leave. The United States is the United States. It's still the major political figure that it is. It is still a world superpower in terms of both military and financial might, despite the Trump administration's attempts to destroy us on a world stage. Nobody's going anywhere. And it really depends on how things are taxed, right? Like, is it going to be by income tax? Is it going to be dividend taxes? Is it going to be a real estate tax? Like, they'll figure out ways to deal with the money aspect of it. There's so much fear mongering about, all the 1% leaving the country. Nobody is going to leave. They have a vested interest in the country. They have properties and holdings here. And I'm sure if they were that worried about it, they'd find ways with some of the out of, the foreign bank accounts that they have to figure something out. Don't worry about, multi-billionaires leaving the country. Bill Gates ain't going anywhere anytime soon. He'll be in the grave before he'll be leaving the country permanently. Trust me. Not that I want to see that happen or anything, but yeah.
It's going to be middle-class Americans having to pay exorbitant costs for healthcare and poor people who then have to pay huge premiums for their own healthcare from the government. Even if taxes were doubled on every single American's taxes were doubled, you still wouldn't be able to afford a Medicare for All system in America.
So in that, he's speaking to the fear of the middle class by saying, first of all, if we had that kind of thing happen where they all did leave, it would all fall in the middle class. That's just fear mongering. It's trying to create the idea that it's going to be the average middle class person who's going to be paying for the low class person who cannot afford their own basic thing because of things that they did to themselves or whatever. That's kind of the argument that they used in the pre-existing condition days. Well, why should I have to pay for somebody who smoked, for example, and has emphysema or CPD because of that, right? Like, why should I have to pay for these people, as opposed to having empathy and sympathy? The doubling number came out of a conservative report, a very conservative report about how much money would actually be saved off of certain portions of healthcare spending. It estimated about $2 billion in financial savings for certain aspects of the budget. Bernie Sanders had said that there were some reports saying up to $10 billion. It would still be a substantial tax, and this is where he really does have a good point. And anyone who's saying that has a good point. But I think that one of the things that we need to appeal to is if we can find the money. And there are people a lot more invested in this, and a lot better at economics than me, just random YouTube person, or him, random guy who, by the way, I looked up his information before the video. He's not an expert in any of this. He's not an expert in any field. He just works for Prager U, and doesn't have any sort of credible expertise or even a bachelor's degree. And I'm not saying that that inherently makes you, unable to talk about subjects. But the reason he cited for leaving college is because it was something to the effect of being too manipulative. I'll just look up his thing super quick so that I'm not misquoting anything. His name's Will Witt. Prager U. Here we go. He's a Colorado native, attended University of Colorado Boulder for 2 years before he dropped out, a decision he made because based on relentless indoctrination of universities in America constantly push. He was talking about indoctrination from universities, so I don't know. I kind of can't take that seriously. So, like I was getting at, people with much better backgrounds in economics and medical research and balancing budgets will handle this kind of stuff. If it's affordable, me personally, I think it's a go. If we can manage to get it into a budget, let's go. Other countries have done it. It's clearly possible and feasible in some manner. And the reason for that is the amount of stress it removes off the average person. The fact that it removes the stress off of certain components of bargaining with employers. It removes a lot of stress off of the immediate aftermath of a truly scary moment in people's lives, either a loved one or personally ending up in the hospital. You know, there's always that one person who has to kind of sneak in and be like, hey, can I get your insurance card and your information and make sure you can actually pay for this procedure? You know, I know we save them from, you know, whatever it is that their reason that they're here, but we need to kind of see this information to make sure we're not transferring you to the, you know, less funded hospital. That kind of thing would go away. I think that loss of stress and anxiety on the average citizen would be great. I think more people being able to actually address their medical needs would be a good thing overall. And just having a society that we know is going to be healthy. And if we had a situation like a pandemic, we might be more prepared for it. How about that one?
So let's go over this. Medicare for all destroys competition in the free market.
Yes, but that's not a bad thing.
It destroys medical innovation.
No, it doesn't. It just shifts who's medically innovating, possibly to a more efficient system. That has done a lot of good already and could put the United States government in a position to create a lot of very innovative researches and take the collective data that they pick up to aim at specific needs of people and the needs of collective peoples, I should say, that a private insurance company doesn't necessarily have the vested interest in because customers come and go. Versus all citizens in the U.S. are all citizens in the U.S. and will remain as such as long as they're alive. So they have a vested interest in dealing with the collective trends of people as opposed to trying to cut people off of their plans in order to cut costs.
And thirdly, it is too cost expensive to ever have in America. So when you hear leftists talk about...
If it was truly too expensive, we would have already said it is too expensive. The fact that we're still trying to sit there and figure out the numbers and figure out the bargaining of how cheap we can get it and still maintain a status of like it actually being a functional system means that there's probably still some parts we can cut off and still have a decent system. And you're weighing that economics against human life. And again, human life is not something that you can easily put a price on. So while it will be expensive, I don't think it's prohibitively expensive or impossible.
Medicare for all or free healthcare for all, remind them that that is an anti-American idea and that we should be looking for freedom against government control.
It's an anti-American idea, and we should be looking for freedom of control, from control. I don't see what is anti-American about maintaining the health of American people. I think there's a play to the socialism card there that he's just not saying socialism, even though he's referred to socialists in this video, and I chose to ignore it. This just feels like he's appealing to the American way and picking oneself up from the bootstraps. It's not an actual argument.
I'm Will Witt. Thanks for watching. What's up, guys?
I'm not going to let him promote. So, with that said, you basically have a system that, while financially expensive and very, very difficult to sort out the numbers for, and I don't think a lot of people have a full grasp on the numbers yet. I think there's been studies, I think there's been reports, different states have put out different models. But if we're able to come up with a way to financially and feasibly perform this, you have a system that will actually reduce the immediacy of problems for the average American citizen. You will allow for people to get more access to healthcare. Wait times for the average American, including those who cannot see a doctor, will decrease. You get a situation where innovation probably will not disappear, and in fact might improve in certain regards to target the specific needs of the American population. And generally, we do a humanitarian good by allowing more people to thrive. And if you really need a conservative argument to throw out there, if you desperately need it, healthy workers make for healthy employees. Healthy people are healthy workers and therefore make for healthy employees. If you really need to make that argument, go for that. Having sick employees, it cuts company funds. Maybe the government is actually subsidizing a little bit of business there. Because with businesses not having to pay for insurance either, they essentially get, for nothing, the ability to not have workers sick in the workplace and bringing in the illness as much, because they couldn't afford, the worker couldn't afford their medical bills. There's whole arguments behind that I could extrapolate, where because if a flu, for example, spreads in a workplace, you create a situation where that person is down employees for, the person who owns the company is down employees for a section of time. The point is, there's arguments across the board of how it would influence and benefit the average American and even some of the average small business owners' life and business and everything. So if we're able to afford this, it should be a go. The reasons that he has cited in this are not effective. He struck me as someone just trying to bullet point a bunch of things out there and make us all just kind of scared. As opposed to having a conversation about it, which is the kind of thing I'd really like to do. So if you have anything to say about, maybe you have an experience with a form of Medicaid for all, if you happen to be from outside of the country, the United States, if you're from like the United Kingdom or Canada, feel free to comment on some of that. Maybe give this video a like, let me know that I'm making content that you're enjoying. And, let me know what else you'd like to see. I want to produce more content that reaches more people. So with that said, my name is Anarchist Tara, and I hope you enjoyed watching, and I hope you stay happy, healthy, and you have good healthcare.